Hello, everyone. A very warm welcome to Lactation and Empowered Moms. Today, we have three of us as working moms, young mothers. I am Vidhi Berry, a lactation specialist, and I'm here to have a discussion with Dr. Chowdhury and Shikha Bharadwaj. Dr. Chowdhury is a leading gynecologist in Kolkata, who's also incidentally the mom of a 2-month-old baby. And Shikha is the CEO of BitQuest, which is a Malaysian social media marketing company. And she also has a 3 to 4 year old. And both of them I have worked with over the last years and months. And we're here to share our experiences as mothers in our maternity journey, in our breastfeeding journey. And the need of the hour is to really, really understand what's going on around this narrative of breastfeeding, this narrative of fear. And I want you both to shed light on that. So I'm going to start with Shikha today to tell me a little bit about the challenges you faced at your workplace regarding once you had your baby. What were the immediate things that you faced?
Once I had a baby, I think, of course, apart from pregnancy, breastfeeding post-pregnancy is a very emotional journey for a woman. I think every woman would relate to that emotion that I'm talking about. Like, I remember when my son was born, he was to be in a NICU for around 2 weeks post his birth. And I was not allowed to breastfeed him for 10 long days. I still remember it was 10 days that doctor actually allowed me to feed him directly. And trust me, I think I felt like I cursed myself. I thought I did something really wrong in my life that I wasn't allowed to feed my baby directly. I was pumping for 10 days. And after 10 days, when I actually fed him for the first time, it was a sense of satisfaction, a sense of, emotional. I still get goosebumps when I talk about it. I think I felt so complete. It felt like my pregnancy felt a full, a complete journey with my feeding my baby directly. So I think breastfeeding is a very important part of pregnancy as such.
And what stage did you join work? What stage did you join work?
I joined work just exactly 1 month post my baby's birth. So that was also very interesting. Like my pregnancy and delivery was divided between two countries. Like in the 7 month, I traveled from Kuala Lumpur to Kolkata for my delivery. And post my delivery, I was here for 3 months. So, working with my Kolkata office. And
Right.
1 month confinement, I started going to office and I was carrying my baby in that baby carrier with me to workplace. I started slow. I started with 2 days a week and then 3 days a week. I started like that. And while I was carrying him, of course, it was our own office, so I had the opportunity to be able to feed him in the workplace and that opportunity to carry him. But having said that, I think the biggest challenge that comes in is the people judging you, whether it be at workplace, whether it be at your house, your own family. Like I remember everyone judging me, saying that you have such a young child. Why do you have to go? Why can't you just be at home and feed the baby at home? You're carrying such a young baby with you. He's not even holding his neck well. I mean, 1 month baby usually doesn't even balance the neck as well. So
Yeah.
much to carry, and I think there's something like a mother is always a good mother. Like you judge her all the time for what she does. I mean, let her be, let her decide, let her heart decide for herself. This constant judging, constant comments from others really brings a morale down. So that is very challenging for a working mom. I think that's the
I,
challenging part.
I think with all of us working mothers, the first thing that comes up is self-doubt, and that self-doubt stemming from within and other people putting it in us that, what is more important than your child? And you absolutely can't be more important. So forget yourself and
Yeah,
focus on this. Coming
yeah,
to that balance is the tricky part. And I think Dr. Chaudhary might be facing that because her is a call of duty. She's a doctor, and I think you can't switch off from that, whether you have
Yes,
or not. So tell me, Dr. Chaudhary, how important is it being in the medical fraternity that something like lactation counseling, does it add value and is it a need? Because you don't know this as a medical practitioner and as a mother now.
so I'll tell you, being a new mother, Like every woman is emotionally, they're vulnerable, they're fragile. I'd say vulnerable because they always have a sense of self-doubt that whether I'll be doing enough for my child, whether I'll be able to take care of my child, do I know all those things which I ought to know being a mother?
Absolutely.
And then comes in the breastfeeding part. Whether I'll be able to breastfeed, whether the latching will be happening well, whether my breast milk is sufficient for my baby. And to top up, the others, the family members, maybe in-laws, your parents, keeps on telling that, Array, maybe you're not having that ample amount of breast milk to feed your baby. So
Yeah.
there's a sense of self-doubt or a question. But in that part, for feeding your baby, your breast milk is the ideal food which you can give to your baby. This is
Yeah.
the need of the hour, right? So here, this to let go the self doubt, this awareness has to come in that what exactly this lactation is, and
Yeah.
here our lactational expert like you people come in, who creates the sense of awareness in the mothers, who tells us what exactly it is. If counseling is required, you have to explain the mother like what it is, how it is, antenatally and postnatally. Breastfeeding is not always about postnatally. It comes in antenatally only, like how to that sense developing slowly and slowly, slow and steady. So
Yeah.
emotional support given by the lactational counselor, the education, the awareness, everything a proper lactational expert is supposed to give. So I believe as a gynecologist, I always need a lactational expert in all the cases. I need you in every cases, to guide my patients so
Yeah.
that
Yeah.
they understand what it is.
Would you agree? Because this is an increasing phenomena I find in cities that all of us having grown up as women in cities working, our education didn't include maternity. Nothing in our education prepared us to be mothers, prepared us as this is what breastfeeding is going to look like, this is what labor could look like, this is what if you have a surgery looks like. And
That
this
awareness is not there.
and there's no experience because we don't have big families or any reference points. So I think there's a huge disconnect here where the need for different practitioners, health practitioners around maternity has arisen. And it's a need of the hour for working women especially because we want current knowledge which can be fused with modern and traditional support systems being contextual in India. So I think that is definitely the need of the hour. So Shikha, tell me, how did you overcome your individual lactation challenges? You said you went there after a month. You took your baby, and fortunately, you were in a space where you could carry your baby. But then,
Yeah.
come all of these things like, okay, should I pump? When should I feed? How do I maintain milk supply? Because I'm tired. Okay, you're working and you're feeding, and it's totally new for your body to do both things together. And I'm sure there was pressure to eat a whole lot of food.
Yeah, of course, there was immense pressure to eat a lot of food, but yeah, I think my mother-in-law and my mother both have been very supportive. They particularly have been very supportive, apart from other people around. So, but of course, you have to pump sometimes when you're traveling, or you have to really go out somewhere. Otherwise, you're yourself feeling so uneasy and so heavy that you have to pump sometimes. So I was kind of juggling there. And I think another issue that I faced there, as Dr. Suchismita just pointed out, that there is a immense sense of insecurity in women. That whether your body is producing enough milk or not. I remember, if I don't know if you remember or not, but I called you up and I told you that that I think I'm not producing enough milk, and you laughed and you said there's nothing called your body is not producing enough, and you broke that myth. Because when you're feeding your baby, there's a connection between the baby and your body, and
Yeah.
your body exactly knows how much milk your baby needs, and it automatically produces that. So don't be insecure about it. It is producing what your baby wants. So I was always topping up some formula milk, because I thought, no, my
Even
female.
I did the same thing, like I messaged her midnight. I mean, 3 o'clock at the night, and saying, I think I'm not producing enough of breast milk. What do I do? So you get panicky at times. You really get panicky.
But apart from technical knowledge, also, I think it's very important to have a lactation consultant in place, so that she even gives you a sense of emotional support. Like, like when you're feeling too tired, or I'm not able to feed. Like, if you remember, I told you that I feel too tired to feed him at night. I feel like this is the last thing I want to do at night. You're so tired. But yeah, I think that emotional support also needs to be there, which can't come from your family or your parents or even your husband. It has to come from someone who's not a part of the family.
Who's
So
neutral.
yeah, who's
Yeah.
neutral, who's not judging you for anything that you do.
I think we are all mothers, and I don't know if you would agree, but I say this to everyone I work with, that all women who have children are made to feel that this is normal because we are supposed to have children. We can bear children. No one emphasizes, and I have to emphasize because I've had two myself, that there is nothing more difficult but nothing more beautiful that you're going to do. And that's the dichotomy and the beauty of this situation. That it is probably the most difficult period you'll go through, those first few months. And Dr. Chaudhary is in those first few months right now. She's still looking fresh, she's still in clinic, still working. And it
Absolutely.
is, I think we are all super moms for even going through it. Every mother is a super mom for going through it. And we always say whether you feed for 3 days, you feed for 6 months, or you feed for 3 years, every single drop is liquid gold. So I always encourage moms go till whatever extent that you can. But tell me, how do you keep your morale high? Because yours is a call of duty while doing this and possibly having those perceptions sometimes that my baby's crying, I don't think I have enough. And then you still have to attend to your clients. And your baby starts crying. So babies don't always work on schedules and they go off. We might just suddenly right now in the next 5 minutes say that I'm hungry. So how do you keep your morale going? Have you figured out a few techniques for that?
First and foremost, who has helped me out is you. Because lactation experts are the one who will give some tips on helping us how do we manage our work and our baby. Like your tips have helped us a lot. Helps every mother, I'll say. So in this scenario, it's very important that you manage your work and your baby's timing well. So you adjust your timing too early, three early. You have to feed the baby every 2 to 3 hours, depending upon the need. So generally we say feed on demand. But for working women, it's not always possible to feed on demand. So what you can do is that you can use this, your workplace, you can go there, you can pump in your breast milk and store that. Of course, because when you're free, in the free time you are doing it, you are feeding your baby. That
Yeah.
physical contact, that closeness is there, that bond is, that making up. And this directly or indirectly helps you up with the, producing your breast milk. So
Yeah.
when you're not there with the child, or like when I'm talking and the baby is with someone else, maybe the baby. So before coming here, I've pumped in my breast milk. I've kept it out for someone to feed the baby. So that is very important.
Yeah.
And what you need is that you need a very supporting family. You need someone to look after that child. On the contrary, like working women are always like they're stressed out, they're anxious, they're like under constant pressure that am I doing the right for my baby? Baby, everyone knows a baby needs a mother. Like exclusive breastfeeding is the demand for 6 months.
Yeah.
So when we start working, we have that guilt that am I doing the right thing? Is work that important? Well, I say yes. Work is definitely important. You need it for yourself and for your baby. Because when a working woman comes back to work, she feels like that is the time when she feels complete, good. That I have a baby, yes, I am being able to take care of the baby as well as the work. So, but then this is all about this thing. But what important we need is a good lactational expert who will advise you from time to time how to manage your thing.
Yeah, because I think you're managing a few things. You're managing number one, your time. So how you pace yourself, because you don't know necessarily if your baby will follow the schedule.
Yeah, correct.
And,
See,
and the food intake is another one. I think if you eat too much, you feel sluggish, you can't work. And if you eat too little, you feel I won't produce enough milk. So that's a very big balance to follow in our culture because food is emphasized, I think, way too much in Indian culture when it comes to lactation. The first thing a mother asks me when I enter the hospital is, What do I need to eat to lactate? And I think both of you have realized that's the last question you should be asking. There's a whole lot before that comes in. And I really want to highlight when you say a family of very supportive family, because emotional support and physical support, where at least your family doesn't make you feel guilty emotionally or physically, feeding your baby and fulfilling yourself for those 2 hours a day. Whether you choose 2 hours, 4 hours, 8 hours, at whatever time you choose. I think for every mother, that's a hard choice. Whether it's at 1 month or 40 days, I think all of us here, at least on this panel, started working in a small way at 1 month and then started building back to our regular hours. And we all had to follow schedules for that. We couldn't do the on demand because we had those timings that we had to follow. And definitely there are others who wouldn't have to follow and can go with the flow. So definitely this scenario works differently for your circumstance, for your family type, for your work. Are there any tips, Shikha, that you would like to share, because you are juggling between two countries? How do you feel like we can keep the morale of mothers up, and the advice that you would give with the 3-4 years of experience you had in two kind of cultures?
Yeah, I almost have a 5-year experience now. In September, my baby will turn 5.
Thank you.
Time flies. No, I think the biggest advice that I want to give is that do not try too hard. Just let things flow organically. You do what is right for yourself, for your baby, for your family, for your work, and then things will fall in place. Do not try to compare yourself with others, because your pregnancy journey and your maternity journey is very different from others. I think this sense of comparing yourself with others is also one thing that pulls your morale down, that she's able to do that and I'm not able to do this, because your journey is different. You are a different person, your baby is different. So do not as I said, do not pressurize yourself too much. Don't try too hard. Just because this is what I feel, this is what I did for myself, and it really worked for me, that I did not push myself too hard. I just did what was right. And I think things almost fall into perspective. Like, until first 2 years I didn't have a nanny or anyone to take care of my child, because until 2 years baby is not able to express themselves that well. Even if the nanny is not treating your baby well, you wouldn't know how the baby is feeling about certain things. So until 2 years I made sure that he was completely and all the time around with me, whether I was at workplace or wherever. But that doesn't work for others. As you said, that not everyone can carry their baby with them. So
Yeah.
do what works for you and go by the flow. Just keep it natural and organic. Do not pressurize
I
yourself.
think this is an important point that you brought up, is about comparison.
Yeah.
Because this comparison starts right from the hospital nursing room, where one mother has flowing milk and one mother has one drop coming out, and she starts to compare. And then right from there to going home, there are mothers groups that are there for support, but sometimes it's something different happening there other than support, because you're comparing, and sometimes someone said something that you hadn't even thought of. And you're like, my baby doesn't do this. And that leads to further self. So how do you guard against that? Have both of you faced that? Dr. Chaudhary, have you faced any kind of peer support or peer negative pressure which has made you start thinking differently from what you think?
See, even me being a doctor, I have the knowledge, right? But there
Yeah.
have been circumstances and like situations where I have started self-doubting myself. Like I fear that whether I am producing enough breast milk. Though I
Yeah.
think when I talk to a patient, when I tell them, I tell them that it's very easy for me to tell them, this is good, this is
Yeah.
sufficient. But when it comes to me, myself, when it came to myself, I definitely had a self-doubt. I am feeding my baby, still my baby is crying. I'm trying this, I'm doing that, I'm doing this, still I cannot, whether I'm being able to, I mean, whether my breast milk is enough or not. So there is always a self-doubt. I think this is there in most women,
New mothers.
new mothers,
Uh,
yeah, correct.
what I find is that the need of the hours also become prenatal awareness in this. A lot of people ask me this question that why should we study lactation or become aware of lactation before we have the baby? Once we have the baby, I'm sure naturally it will come and we'll be able to feed. The baby has to eat. It will go to the breast and find it. And it's the
That's what
same.
I said. Yeah, that's what I say. That rotational this thing should start antenatally.
Absolutely. Just like we do a little bit of childbirth education when your patients come to you, I'm sure you tell them this is what the process is like. This is what would happen if you had a natural birth versus a cesarean section. These are the risks. This is how things go. And just like they're being prepared for that mentally, this is also a mental preparation. Of course, nothing gets you to the actual physical act, but you're getting there because I can say this being a lactation specialist, that yes, the self doubt existed even in me with my second child for whether it was for 5 minutes or for 1 hour. And at those points, it is the lack of objectivity. I think we are all, you must be tired, exhausted at this point at times, and you still look fresh. But the idea is that we lose objectivity when we don't get sleep, and you're really not going to get consistent sleep. And that's the space where that subconscious knowledge that you've been learning for the last 5 6 months, that comes in handy, because something in your head says no, that's not true. What you're feeling right now is clouded judgment because of what you're going through. And this loss of objectivity, I think, Dr. Chaudhary, would you agree it's more now because of the current circumstances? Would you feel that in our current scenario with the COVID circumstances, do you think there's more loss of objectivity?
See, I would take this opportunity to tell you the WHO guidelines
Yeah,
for breastfeeding, right? It says that you should start your breastfeeding within 1 hour, okay, and till 6 months, exclusive breastfeeding. And then we start off with nutritionally adequate solid food from 180 days. Along with this, you can continue with your breastfeeding till 2 to 3 hours, whatever you're comfortable with. Now, breastfeeding, breast milk, I'll tell you, it's the ideal food that you can give to your child. It has all the essential nutrients, it has the energy which your baby requires, it has the antibodies, it provides immunization, the immunity to your child, it prevents the childhood illness. So, it has its own beneficial aspect. And here breast milk is required. So, but now in this current COVID situation, people are always anxious, most anxious, and they keep on questioning that should I breast milk? I might be positive, I might be symptomatic, I might be asymptomatic. I'm having cough, I'm having sneezing, I'm having fever. Should I breastfeed? Well, WHO says that yes, you should breastfeed because the beneficial aspects of breastfeeding overweighs the risks. So
absolutely.
always try to breastfeed your child. That is the best thing which you can do for your child and for yourself.
There is an
And
overwhelming family, even though mothers choose to feed and they know they've read the guidelines because they want to know immediately. The family says no, nobody knows what this is. They're saying this now, they'll change it in 5 days. And the mother's like, no, but I need to feed my child because there is nothing else out there. This is the only way. So please add to that.
yeah, definitely. See, in this COVID situation, there are certain precautions you might take. You need to take rather, as in frequent hand washing, right? Then always clean in normal scenario. Also, always clean that nipple areola area before feeding.
Yeah,
You try to sanitize the toys or like the materials which comes in close contact with your child.
yeah,
You wear a mask wherever it is possible. Whenever you are sneezing, you're coughing, you use a tissue and always dispose that tissue then and there only. So
right.
you need to maintain certain precautions, but apart from that, it is breastfeeding, 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 which answers all your questions.
Absolutely, absolutely. I think my takeaway is, which I believe truly, is that we as mothers can't operate from fear. Yes, we are faced with an unprecedented situation and risks, but when it comes to mothers and babies, the equation still remains the same. Yes, in a new scenario, awareness, precautions, safeguards, all of those become relevant, but still separating a mother and baby is never the answer, because the highest chance of growing well, survival, thriving is always with the mother in this practice. And I will share with you that I've had so many situations where mothers panic. They might have certain infections developing or lumps developing, any of those things happening. And they are happening more due to the fear. The minute we counsel them, take them down and say, okay, do these home therapies, wait for a day. Wait for a day, nothing will happen. And you see that with breathing techniques and home remedies and just calming down, everything disappears. The mother becomes okay because her whole starting point was that what will I do if something happens in this situation? Will I have care available and what happens to my baby? And I think all of us have to reassure mothers now that mums are solutions to babies. The breast milk is the solution to baby, and there is no other way. So I think mothers need to just focus on this and work harder on achieving this with the right antenatal and the postnatal care. Anything else you want to add to this?
No, I think, Dr. Suchismita just completed the entire discussion, saying that breastfeeding is best for your baby, come what may, just follow your instinct.
And go with confidence and not fear.
Go with confidence. I think confidence is very important. And I think to sum up, I would say that develop a thick skin to being judged by people. Like now, it doesn't matter to me. You want to judge me, you judge me. You want to say something, I'm okay. Like I will just do what is right for me and my baby. What I feel is right for me and my baby. Just do that.
Thank you so much. That's a great starting thought. Thank you so much. Yes, please tell me.
Yeah, the mother is the best person to know about the child.
Yeah.
Just remember, this is enough for you to take away. I mean,
this is the
that
best.
is all the question.
You know best. Mother knows best. No matter how new you are, but still know the best.
Initially, 10, 15 days, you're also the new mother is also new, even the baby is also new. So that problem does come in, but then with time, with that physical contact, with that bond, with that time, as time goes in, the bond also increases, and slowly you'll understand the mother is the best person to judge. I mean, to make decision about the child. It's not your parents, it's not your in-laws, even it's not your husband also. So the mother has the thing to understand what's the best for the child.
Absolutely. Absolutely. Thank you for that thought. And I want to announce that this is this is the first session in an endeavor by initiative that I've taken, which is a healing initiative by my company Heal, where I am here to provide knowledge that every mother, every individual is enough. There is no room for guilt and self-doubt in any of us in all our endeavors. So we need to heal ourselves with that thought that we are enough and go forward and in all our endeavors, today especially as mothers. So thank you so much for both of you being here. Thank you, Modella, for partnering with us. And I look forward to seeing you next week with more learning and more healing information. Thank you and good night to everyone.
Thank you so much.
Bye.
Bye bye.